So looking ahead, this is what we're going to talk about today. The first half hour is Mr. Patel, who's going to talk about leadership in a crisis. He'll cover vaccines, the merger with Virginia Mason, growth on the Kitsap Peninsula, and more. The second half of the hour is Lesli Dullum-Tutterrow with Live Well Kitsap. And now here's something that's happening tomorrow and next week that's really important for our small business community. It's information on pandemic relief. The SBA has been the primary source of fiscal relief for America's small businesses, definitely through the Payroll Protection Program, but there are a variety of other forms of small business relief that are coming. So America's Small Business Development Centers and our partners at Western Washington University, the SBDC on the Kitsap Peninsula, have us covered. Tomorrow, January 8th, from 10 to 11:30, you can register for the first of 2 webinars. And there's going to be plenty of webinars coming. But if you really need to know what is happening with the SBA and the PPP programs, please register for this. It's going to be really timely. 3 guest speakers will talk on that tomorrow from the SBDC. And then next week on the 14th, 10 to 11 a.m., our partners at Western Washington will also hold a second version of that webinar. And it'll have information from 6 days because the regulations are continuing to be updated, continuing to come out as we speak. We'll put these links in the chat shortly. Mark your calendars for February 18th. It's our annual economic forecast. Obviously, we're going to make it virtual. We have a guest speaker from Austin, Texas joining us, John Karras with TIP Strategies. He's going to talk about the rise of the work from home workforce. And of course, the dynamic duo of James McCafferty and Hart Hodges from Western Washington University talking about COVID, its economic implications, and how that'll affect the Kitsap Peninsula. But without further ado, I think we're ready to introduce our guest speaker, Ketul Patel, CEO of CHI Franciscan. He'll speak, and then there will be time for some Q&A. Just type your questions in the chat. Mr. Patel, thanks for your time.
Joe, thank you very much, and I just want to thank all of you for joining us today. It's kind of my privilege to spend a little bit of time with all of you just to talk about the journey that we've had at CHI Franciscan, and also what's happening around the organization right now. There's really 3 topics I want to cover. The first, we've got some exciting news to share, which I'll go through here just in a second, about our merger with Virginia Mason Health System. The second thing, just give you a little bit of an update on what's happened over the last number of months that all of us have lived through the pandemic, and how at least the CHI Franciscan, as I call the legacy organization, has now dealt with it, along with all of our leadership teams and staff, who I just cannot be more proud of. And then lastly, just be very open to questions that you might have. I just want to also recognize a couple people that I know are very active amongst this group. David Schultz, who's one of our key leaders within CHI Franciscan. David and his team have just done an incredible job with the opening of St. Michael Medical Center in Silverdale, and obviously Jim Savello, who's been one of my bosses for a number of years, and recruited part of my recruitment process, and several years ago, and a very, very active board member for CHI Franciscan during my tenure here, and all of his leadership in the Kitsap community. So Teresa, if I could ask you, go to the first slide, please. So let me just talk a little bit about the really important news this week for CHI Franciscan. In 2017, Franciscan signed what we called a strategic alliance and clinical affiliation with Virginia Mason Health System. And the primary issue around doing that was that we felt very strongly that we needed to have a larger scale in terms of what the future was going to bring us. CHI Franciscan has always been what I would call a South King County, South Sound, and obviously out pretty significant presence in the peninsula when then Harrison and now St. Michael became part of CHI Franciscan. But we've always felt that we needed to have a significant presence in the largest metropolitan city in the state. We actually spent a lot of time looking at different potential partnerships for us at the time. And we believe that given Virginia Mason's very strong clinical reputation, the fact that they started as a physician group practice and then moved into a larger integrated system was really the right partner. And so we entered into that relationship in 2017. Over the last year, there was, as things move forward with our understanding of each other, there was a decision amongst our boards to start having some discussions about bringing the two organizations together. And so you may have already seen that this week we announced the formation of Virginia Mason Franciscan Health. That's the new name for our system. It was formed on January 1st. You can see some of the stats here. We have 18,000 team members, 5,000 employed physicians, and what we call affiliated providers that are very close to our system itself. We have 11 hospitals, which obviously includes St. Michael's and in the Kitsap Peninsula. And we are, as many of you probably already know, we're also part of a very large national health system. In fact, it's the second largest health system in the country, Common Spirit Health. It was a formation of what was Catholic Health Initiatives and Dignity Health. And Dignity Health was primarily in the state of California. And historically, CHI Franciscan was part of Catholic Health Initiative. So we've gone through a lot of change as an organization in the last couple of years, and we have even more change to come certainly in the coming months, and if not in the next couple of years, as we put this merger together. But just to give you a sense of this, we announced this publicly on Tuesday. Gary Kaplan, who's the Chief Executive Officer of Virginia Mason, and I had town hall meetings yesterday with all of our staff, giving an opportunity to answer things together. You'll hear a lot more about this in the coming months, and I'll make sure that David, shares some of the things that we're doing with all of you, because it's an exciting time for us. Teresa, if you could go to the next slide, please. So let me just pivot a little bit to the pandemic, because again, I know that that's top of mind for everybody, but just to give you a sense of what Franciscan has done, and over the last year. Our first COVID inpatient case was on February 29th of last year. The first one was at St. Anne and Burien. And all of us remember that time, a lot of anxiety, a lot of concern, not a lot of guidelines. We were following the CDC guidelines as we still do today, but those were evolving rapidly, as we were learning more, and literally minute by minute, day by day. We were changing protocols and policies, and as the numbers continued to increase at St. Anne and Burien, and then we started seeing patients at the St. Francis and Federal Way and St. Joe's in Tacoma. Kitsap County was not seeing the numbers that we were seeing in Pierce and King, and obviously that has changed over the months that went past. But just to give you a sense, we stood up our what we call our command center in January, knowing and assuming that this pandemic was going to leave Asia and come here at some point. We just needed to be prepared, and so we started a lot of the things that you're seeing here: daily communications for leadership, daily communications for staff. I recall in March, April, and May, June, that we were having, our command center, if you will, calls system-wide with over 60 to 70 leaders sharing what was going on, what our staff were saying, what kind of resources that we could get to different organizations when we needed it. So, these are times when we actually really benefit from being a system. As you started hearing in the community about the lack of PPE and testing, I will tell you that because we're part of a $30 billion system, Common Spirit Health, our supply chain was very good. We had ample supplies of PPE that we needed. We evolved with time with the guidelines, but we actually were quite better, if you will, than other hospitals, not only in the state but around the country, that were truly in dire need of supplies. And so it's a good opportunity for us to see. And you can see on this slide here, just thank you, Teresa. Actually, you're going exactly where I wanted to go. We created a hashtag called Franciscan Strong. We wanted to be, we're trying to unify and unite us. We were looking for good things in dire times. our staff are just absolutely exhausted. There's not a time when I go around the system, or David or other leaders tell me that our staff are just, they're tired. And I think that we've said, and we can't say enough, how much we're in awe of them. They're truly taking care of our patients on every single day. We've had staff. I had a staff member at St. Joe's Medical Center that did go home for 3 weeks. He found another place to stay because he and his wife were expecting a baby, and again didn't know what was going to happen, and so he stayed away. And then once the baby was born, he was reunited with his family. We've got stories like that everywhere, and it's just a great opportunity for us to show that we've shined during that period of time. But again, I just want to say again how proud I am of all of us at CHI Franciscan. I know that all of you have heard about the fact that we've had outbreaks, from time to time. We've managed really well. David's leadership has been extremely strong during that time. He's got strong leaders and managers, but it comes down to our staff being able to handle the patients that are coming in. At the same time, dealing with things personally at home with the risks that they're exposed to as well. So I just want to comment on that. Teresa, if you go to the next slide, please. I want to give you a scale, an idea of scale of how things are changing in healthcare. And during my entire 25-year career, we've talked about truly scaling healthcare services to the consumer, if you will, in the way they want it, right? And we've become more and more of a digital company and digital organization and digital industry, and healthcare has been very slow to adopt a lot of that. But I think the pandemic has forced us in that direction, and I think it's going to lead to some really good things, even though it doesn't feel that way right now. Just to give you a sense, before the pandemic, we were seeing about 10 virtual clinic visits a week, 10, and they were predominantly for behavioral health. And you look at what's happened since March, through Zoom, we have over 1,200 providers that have now seen almost 250,000 virtual clinic visits and over 14,000 what we call urgent care visits. Huge change for us, huge change for the industry. The payment mechanisms have changed around that as well, and they need to continue. We actually also opened up what we called a mission control center, which is based in Gig Harbor in Point Fosdick. And the mission control center does two very simple things, which is, I say simply, but it's really complex. It's a NASA style, organization, if you will. If you would go there, you'd see screens everywhere, but it allows us to really track our patients and the need to, when we need to transfer patients, we need to also forecast our bed capacity, our bed need. And we actually stood up the Mission Control Center in October of 2019, and well before the pandemic. And when we stood it up, we weren't thinking at the time that we were going to need it even more so. But we've been able to transfer patients because of bed capacity and bed need, because of our Mission Control Center in a very, very seamless way. Without it, there'd be a lot more phone calls. You're relying on staff to have the right kind of communications. Here you are now predicting, what the needs are based on OR schedules, based on procedural schedules, et cetera. And it's just been fantastic for us. The other thing that we've done is, as many of you might have been part of, historical Harrison and now St. Michael, some of our foundation events. With our Silverdale Hospital opening, we decided to have a foundation fundraiser virtually. It's the first one that we've done, and we've got great leaders like Sarah Chamberlain that's out there that really, if you were involved, you saw her, on screen with some of the work that we were doing. And so I just want to say how proud I am of our team to really take these times to be, drivers in moving us into a much more digital stage. I will tell you, sitting in my position, I think our digital and virtual capabilities are here to stay, and I think it's a good thing. We have over, with Virginia Mason and Franciscan Health, we have over 300 sites of care. And I think as we scale up our digital capabilities, you'll see less. And, we'll be, our patients will be happier. You don't always have to go back in to downtown Seattle or downtown Tacoma or to Silverdale for a follow-up visit. And when you can do it, virtually, I think it's just exciting for us when we come out of this. But, it's sad to say that the pandemic has driven us to this point, but it's just a, great opportunity to look at one very good thing that's going to come out of this for all of us. So Teresa, next slide, please. Just a couple of things I want to mention. I know that the vaccine is probably on a lot of people's minds. We started our distribution of the Pfizer vaccine on December 15th. We have 8,000 staff members that have already seen the first dose. By the end of tomorrow, we will have 10,000 staff that have finished their first dose. We are now distributing the Pfizer and Moderna vaccines. In fact, we've been very strong in our approach. We've been very thoughtful. We're obviously following the guidelines with Governor Inslee. I, along with many of my colleagues that lead other healthcare organizations, had an opportunity to speak to Governor Inslee yesterday morning, and we talked to him very much so about the fact that we need to have a little more flexibility and partnership moving forward, because we don't want every person in the community coming into a hospital to get a vaccine. We want to open up the Tacoma Dome in Tacoma. You want to be in downtown Seattle. You want to go to different parts of the community where you can do things in a very safe and healthy way, and partner with community organizations around the entire state. So we did position that with them. We'll see what comes out of it. We've obviously got guidelines that we have to follow. I will tell you that the one other thing that we've said to him is that we need to have a little bit more advanced notice of our supplies. And to give you an example, there's been weeks that we only got 400 doses. Another week we got 17,000 doses. So it's hard to plan. And we've been very, very thoughtful around some of that. So let's go next, if you could, to the next slide, Teresa. I just very quickly, there's a lot of things going on, even in what I would call the historical organization. But you may know that we've changed our names around the Franciscan system. St. Michael Medical Center, St. Anne, which were formerly Highline and Harrison, are now our new names. It was a way for us to unify our brand within CHI Franciscan. As many of you know, St. Michael is still a secular organization. It's something we're very committed to. It's part of our design as an organization to celebrate our Catholic history, but be very, very true to the fact that we've got secular, non-Catholic organizations that are part of us. And it's something I believe that helps us be who we are in terms of our values. We opened up a Northwest Family Medicine residency program. We do have a brand new OB joint venture that we opened up in downtown Seattle before we announced our merger. But just going back to our family medicine residency program, we felt this was really vital for the future of St. Michael and also the future for for CHI Franciscan. We always struggle to recruit physicians, particularly primary care physicians, in a lot of our communities. And having the ability to have a family medicine residency program that is locally grown, if you will, we'll be able to train our next generation of medical professionals who, and hopefully, if they're not from this area, they'll see the beauty of our community and will want to stay. And so it's a great opportunity for us to not only influence their minds and train them, but to keep them close to us after we train them. And what a better place to have that done than be in our brand new campus, if you will, at Silverdale. A couple other things as part of CHI Franciscan, we have the largest birth center in Pierce County. With the number of deliveries that we have new space that we opened up for our NICU, 15,000 square feet. So we're seeing more babies, smaller babies that are born, and it's just a great opportunity for us to shine in what we call one of our signature service lines. We also, I want to just celebrate this. There's a company called Leapfrog that gives you grades for safety ratings. Several years ago, when I first came to Franciscan, we were in an organization that was graded, B's, C's, and we actually had an F. There's many schools of thoughts on this, right? There's companies that will grade you, but when a company gives you an F grade or a D grade, it's not a happy moment for any one of our leaders. And what I'm really proud to say here is that we are now all A's and B's, and we want to be all A's, and we're planning to be all A's, but we now have the most A's of any system in the state. Something that we're extremely proud of, as I said earlier. But again, we're not going to be happy until Leapfrog, which is very well known around the country, gives us all A grades, and we've got plans to get us to that point. Teresa, next slide. And again, I know that so many of you have probably already seen our campus living in the community, but I can't. It's just absolutely spectacular. I was out there during the holidays visiting David, and got a chance to see it again. This is a long time coming for us. Frankly, we wanted to open it up sooner, but we're excited that it's been opened up now. I think this, you build hospitals like this for generations in a century. And so it's not something that we see that's going to change anytime in the next week or two. So these are big things. We've spent $500 million in the community, not a small number. There's not many hospitals around the country that are being built. On the inpatient side, there's a lot more dedicated resources on the outpatient side. So that's where we are at this point. Again, just a couple other facts. We're 50% more energy efficient. We're going to reduce waste and water usage by 36%. We've got 242 beds. We do have plans in the future to expand, and we'll see where that takes us. David and I have seen that the capacity has filled up very quickly within Silverdale and St. Michael's, and so we'll see where that brings us somewhere down the road. Certainly not anytime soon. We've got we want to make sure that St. Michael's flourishes in the short and long term as well. And so, last comment I just want to make, if I could, Teresa, is just thank everybody for their leadership and interest at CHI Franciscan. And I think Joe, will open it up for questions.
Great, and we already have our first question, Ketul. So it is a question on, could you explain further mRNA and the experimental nature of the vaccine?
So Joe, I'll be very candid. I'm not a clinician or a physician, so it's a little bit above my pay grade around that. But here's what I'll tell you: we've got several vaccines that are RNA based, if you will. And the questions that I do get around this is, has the vaccine been developed too fast? So I just want to maybe trigger the question in that way. We have. I will tell you, there's been plenty of work that's been done to stand the vaccine up. Period. I think it's again, I'm not a physician or a clinician. I believe the vaccine is safe. We are, we're being very strong about for those that want to get it. Again, on our provider side to do that, for us to be able to not only vaccinate, if you will, 8,000 of our employees, but soon to be 10,000 of our employees, we're in a very, very good place. Pfizer dose, Pfizer and Moderna are both mRNAs. We've got other vaccines that are coming out that are going to be differently based, as all of you probably read about. But I'm happy to get out some information on mRNA versus others. Again, I apologize, I'm not a clinician. I won't be able to go into that kind of depth for that.
Absolutely. Something I was wondering about, Ketul, was, this crisis has upended so many things in our society. As a leader, how have you had to adapt over the last 12 months?
I think, Joe, that there's two or three things that I would say. From a leadership perspective, I will say this: even though we think we communicate enough, we don't communicate enough. David is on the ground. David Schultz is on the ground a lot more than I am. He's got several hospitals that he has responsibility for. I've got the whole system and division, if you will. And I learn more when I spend time with our staff. I learn more when I'm communicating with our staff. But I always marvel with the amount of time that I communicate and David communicates. So we just need to do more. And the more we communicate, the better we become, and the better that we can help shape and guide our organization and our responsiveness to things. We are a heavily regulated industry, and we also have a large amount of staff that are seeing different things, and so we've got to thread the needle in those ways. But that's probably the biggest lesson that I have learned through this pandemic is just, we need to make sure that we're communicating highly effective. You saw in one of the slides I put together the number of vehicles that we put together in terms of communications, but, it's not enough. We got to do more. And, it's not just about communicating, it's speaking, if you will, in the language that people are going to learn. And so that's probably my biggest lesson coming out. I'll give you one more. is that we've got to drive the industry to change. You know, the digital stuff that I had mentioned is a big change for this organization and for all of healthcare. But we've got to be quicker in finding solutions as opposed to waiting for something like the pandemic to take us there.
All right. Final 10-second question. Is the vaccine mandatory or optional for your staff?
We're making it's optional because that's the guidelines around the state. But, you know, we do require, you know, reasons for our staff not to get it. And so, but we encourage it. We're encouraging it all throughout the Franciscan organization, and much like we do the flu vaccine itself.
All right. That is 11:26. I'm 1 minute over. Ketul, thank you for your time. We appreciate it.
And Joe, if anybody has questions, you know, obviously send them to you, and I'm happy to address them over a period of time. Okay.
Joe,
Thank you.
Thank you
there
very
were
much.
questions in the Q&A.
Yeah, we've got Mr. Patel has to move on. He's got an 11:30 start. So we'll
and
see
I
if we can address
David's
them later.
answering it, so we're
Thank
good.
you, Kathy. Thank you.
Okay.
Thank you, everybody.
Thank you.
Bye-bye.
All right, we're going to move on to the second half of our program. I would like to introduce my colleague, Kathy Kokis, who is going to take things over for the next half hour. So thank you very much.
Good morning. Thank you, Joe. I am pleased to introduce Lesli Dullum-Tutterrow. She is a longtime partner of business in Kitsap County. Some of you may know her from her efforts for Living Well with the Y. She has recently expanded that to something new and different, which you can ask her about at the end if you care to. But for now, Leslie's going to share from her experience as a counselor and wellness coach how to manage our emotions during this time in our lives. So thank you, Lesli. You are muted.
Is that better?
Yes, thank you.
Awesome. Thank you to you and Joe for having me on. I got to tell you, I was watching the news last night, which I try not to do for too many minutes at a time. And I was thinking, what a fantastic time to talk about emotional and mental health after the shenanigans and all the chaos going on. I lost you.
No, we're here.
Oh, good. Perfect. Okay, so my understanding is I have about 18-20 minutes.
Yes.
Okay, perfect. Let's get underway. Good morning, everyone. I really appreciate you having me here. This is one of my favorite things to be able to talk about. I want to encourage you all, and I apologize, I couldn't be on in the beginning, so you may have talked about this. But if you have a means of taking notes, a notebook, a computer, a tablet, I don't have any handouts. And that's intentional because I want you to listen and I want you to take notes so that you have something to refer back to. All right, so here we go. These are challenging times. You do not need me to tell you how crazy the era that we are living in. I don't think I ever thought in my life I would see a pandemic. I don't think I ever thought I would see, you know, protesters storming our Capitol. I mean, there's just crazy making things going on, and it can be overwhelming. And I think for many people, there's a lot of depression. There's a lot of sadness. There's a lot of confusion. How did we get here? How did this all happen? And certainly we could talk about all of that, but we have a lot better things to talk about, which is how do we cope? And the first thing I would offer is, for most of us in our lives, this is not the first difficult or bad thing to happen. Many of us have experienced a death in the family. Many of us have experienced a difficult illness or the loss of a job or financial difficulty. And so the reason I named this, you know, learning how to deal with your emotional and mental health in challenging times is because this isn't the only challenging time we have lived in or through, and it certainly is not going to be the only challenging time for the remainder of our lives. So we have to be able to equip ourselves. So today, we're going to talk about 3 things we can do starting today, starting to practice today, that will carry us through the long run. So these are things to focus on in the long term, but also begin to think about presently. These 3 things are: number 1, intention. Number 2, invention or action. Some of you will relate to the word invention more, and some of you have a brain that is more action oriented. So it's invention or action. And number 3 is connection. And I apologize, someone's trying to call me. Okay, all right. And then we're going to talk about 3 things you can do in the moment. In the moment when you're watching the news and it's distressing, besides just turn it off. That's always an option, is don't watch too much news at any one sitting. But we're going to talk about 3 things you can do in the moment to just bring that relief, reduce your stress, help you cope better with whatever's going on. So we're actually going to jump into the short-term ones because number 1 is deep breathing. And it's one thing to talk about it, and it's another to do it. So now that I asked you to pick up your pens and a notebook, I'm going to ask you to put those pens and notebooks down. And because we all have a different lung capacity and we all have a different way of breathing, I'm going to talk about how to do this, and then I'm going to demonstrate, and then I'm going to actually ask you to do it with me. So deep breathing is your number 1 thing you can do in the moment, anytime you just need a little more calm. What we want to do when we deep breathe is always deep breathe in through our nose. Why? There's a certain chemical that comes in through our nose that doesn't happen when we breathe in through our mouth. So we deep breathe through our nose. We're going to want to hold for a count of 2 and then exhale out our mouth. When we're exhaling out our mouth, I want you to really blow that air out. So not like a balloon that we pop where the air all escapes, but where we intentionally blow the air out. Okay? Are you ready? Deep breathe in through your nose. Nice big breath. Hold for 2. Really extend that exhale. Do it again at your own pace. Deep breathe in through your nose. And we should all hear each other's exhale. That is available to you at any point in time. Okay, we're going to come back to that again because we're going to add to it in just a couple minutes. But I want to talk about the 3 things that I first mentioned. Number 1 is intention. What does that mean? It means we need to get off the treadmill of doing things the way we've always done them, getting the same results we've always gotten, and thinking in the same ways we've always been thinking. Are you with me? Someone give me a yes.
I'm cheating, but I'll give you a heck yes, Leslie.
Thank you. Everyone froze on my screen and I'm like, am I in this room by myself having this conversation? What is happening? Okay, so intention says, if I want a different outcome, I have to pause, what I call bring some pause space, or I like the word cave time, into my day, which means I stop the busyness. I stop all the roles and responsibilities, and I say, what in my life, where do I have what I like to call a divine dissatisfaction? What do I want to be different? And then from there, you can consider some options. Maybe you've noticed during the pandemic that you're more edgy, you're more irritable, and you're showing up with your partner or your spouse or your roommate or your coworkers, you're showing up in a more edgy and irritable way. And you realize this is not who I want to be. We see this a lot with moms. And those of you dads that are at home with kids and homeschooling, right? Everyone's like a little more edgy and a little more irritable. So if you don't want to show up in that way, then set your intention, and it has to be specific and positive. So you need to tell your brain the right message. And the right message is, I want to show up as a patient and kind and caring mom or wife or husband. So you make that intention, write it down, and think about that thing. Now, if we don't do anything with that, then we're just going to have a wish. And if we just have a wish, we're not going to have any change. So we need to give it some feet. And the way we give it some feet is number 2, which is invention or action. So I take this goal that I've set for myself, and now I'm going to funnel it down into some actionable steps. If I want to be more patient, if I don't want to be the mom that's yelling at her kids all day, if I don't want to be that mom, what am I going to do? So I might set 3 actionable steps. I'm going to make sure I get a good solid 7 or 8 hours of sleep. I'm going to make sure I eat a good breakfast, because that's going to help me show up with a better body and brain that is functioning optimally. I might decide that I tell my partner or my spouse or my coworker or my child that if they notice I'm starting to elevate in my tone, that they can give me a sign. It could be touching their nose. It could be this. It could be, it doesn't matter what it is, but it's some kind of agreed upon signal that says, Mom, you're starting, the volume's starting to creep up there. And I don't want to be yelled at today, right? And so we can work with the people around us to help us meet those goals as well. And then number 3 is connection. If the pandemic has taught us anything, it's that even if we're an introvert, we were not created to get through this alone. Every brain, every person needs connection points along their day. So if you're a CEO or you're a leader and you're spending gobs of time, pouring over paperwork in your office and you're not getting out and talking to your people, you can change that today. If you're a mom and you're at home and you've been so consumed with just trying to keep your family, surviving and keep things afloat, you've got to find some connection points that are meaningful throughout your day. And the way you can do that is anything and everything, right? There's a myriad of ways. You can schedule a Zoom coffee meetup with a good friend that encourages you. You can set up a date night with your sweetie and have that to look forward to at the end of the week. So you've got those connection points built in to every day and every week. Okay, so intention, invention, or action, and connection. You can pick one of those. I would not suggest all of them, but you can pick one of them and start today and have a focus to simply begin to practice those things. Now, let's go back to the deep breathing. We have deep breathing to talk about. Number 2 is becoming aware and challenging your current thoughts. And number 3 is prayer or meditation or even a quote or a mantra. So I'm going to briefly go over these, and then I promise we're going to circle back around to another deep breathing. Deep breathing is the way that you help your brain function better because you increase blood flow and oxygen. And those 2 things are crucial to having a better functioning brain. Additionally, this is really key. So I hope you picked up your pen again for a minute here. When we deep breathe, we're accessing what's called our parasympathetic nervous system. Versus when we're stressed out, when we're tense, when we're angry, we're living from our sympathetic nervous system. Now, these bodies and brains were created to be in a sympathetic nervous system state, but only briefly. Only occasionally. Like, think about a caveman or a cave woman in the jungle back in the caveman era, when what you had to be worried about was encountering a tiger. And if you saw that tiger, believe me, your heart rate went up, your blood pressure went up, and all the blood and oxygen left your brain and went to your extremities. So you could fight that tiger, or your legs could just run away. But we're not worried about tigers in the jungle. We're worried about things like political and social unrest. We're worried about things like a virus that's taken too many people's lives. And so when we allow ourselves to be chronically stressed or distressed, what happens is all kinds of unpleasant and unhealthy physiological responses occur. Okay, for the short run, if someone cuts me off in traffic, those same responses are going to happen, but 30 minutes later, I'm not thinking about it. When we allow ourselves to watch too much news, when we allow ourselves to stay distressed about events we cannot control, we're living in that sympathetic state. So we need to create options and possibilities and ways to access that parasympathetic state. Things like getting a massage, things like eating chocolate, things like having sex, all bring us into that parasympathetic nervous system state. Now, please don't go home and tell your partner that Leslie said you have to have sex today because you have to access your parasympathetic nervous state, because I don't want to get those phone calls. But what I'm telling you is those things that I mentioned, things like having coffee with a friend or taking a walk or taking a hike in nature, are all things that access our parasympathetic nervous system state. That's where we thrive. That's where we feel like, that we can manage whatever comes our way because we're allowing our body and brain to function optimally. Number two, and I know I have less time than I realize, so I may go through this fairly quickly, but number two is absolutely critical for your mental and emotional well-being, and it's this: we have to learn to challenge our thinking. Just because we think a thought does not make it true. I'm going to say that again. Just because a thought pops into your brain does not make it true. Which means we have to challenge those negative thoughts, those critical thoughts, those self-defeating thoughts, those depressing thoughts. I'll give you an example. If you have noticed lately, and especially with the events of yesterday, if you have had a thought that sounds something like, my gosh, what's happened to our country? This country is going to be in chaos forever. Now, that might be a typical thought based on so many recent events. However, is that thought really true? Can you know with 100% certainty that our country is going to be in chaos forever? And the answer to that, of course, is no. None of us have a crystal ball. But if I chew on that thought, and you know what I mean by chewing, right? That repetitive thinking that thought over and over, what we call ruminating. If I chew on that thought over and over and over, I am likely to feel depressed, distressed, lost, confused, helpless, and hopeless. But if I remind myself, yes, this happened today, and today I will choose blank. This happened, and today I'm going to go take a walk. Today I'm going to hug the people of my household even tighter. Today I'm going to do some journaling, which is another therapeutic tool. Then you're controlling the things you can, and perhaps surrendering some of the things that are beyond your control. Lastly, prayer and meditation. Again, something you can do, boom, at any point in time. You could be in a meeting. You could be driving somewhere. You could be anticipating a difficult conversation with your spouse or a colleague, and you can engage in a prayer or some meditation in that moment. You can do it while you're driving, something that brings us back to breathing. Something I call red light breathing, which is something that is essentially looks a lot like what we just did a minute ago. The only difference is you have to keep your eyes open. So when we engage in deep breathing, We want to close our eyes as often as possible. Please, not while you're driving. Breathe those breaths in through our nose and out our mouth. And in fact, I think I have time to do this with you. Let's have you put your pens down. Whoops. Let's have you put your pens down. And I think we have just about 2 minutes, which is perfect, because I really want you to leave today with something very tangible and easy to begin to implement into your daily life. So if you would, pens down, notebooks down, eyes closed, breathe in through your nose, that nice big breath, hold for 2, and a nice big exhale out your mouth. Now, when you do the next breath cycle, we're going to take it one step more, and it's this. Next time you breathe in through your nose, I want you to notice the air as it comes in through your nostrils. Now, that might sound crazy because you're like, hey, you know, this breathing thing, I've been doing that since I was born. That's this thing I do every day, Leslie. Yes, it is. But how many times have you slowed down to be present with your breath and just notice the feel of the air as it comes in through your nostrils? And so I want you to notice the temperature. I want you to notice what that feels like. And then the exhale out, I want you to set an intention. It could be the word calm. So maybe you breathe in, noticing the feel of the air as it comes in. Maybe you breathe in stress and tension, but you're going to exhale all that out and focus on the word calm. Or you might focus on the word peace. Set your intention. I promise you, if you do even one of these things, even one, don't try to do them all today because you'll just be completely overwhelmed. It'll just feel like a big boulder, and we don't want that. But if you do even one and you start becoming intentional about how do I manage my emotional, mental health and well-being, no matter what is going on in the world, no matter what's going on at home, no matter the challenges and the difficulties with family, with work, with your finances, with all the places that we're all struggling, you can choose to effectively manage you anytime you're willing to slow down and pause and be intentional and use one of these tools. And I would love to take any questions that any of you have for me.
Okay, okay, a couple or few short but effective books that would help some folks with these intentional tools and techniques. Do you have any recommendations?
Oh my gosh. There are so many books out now about mindfulness, which we just scratched the surface on. And I'm trying to think of one in particular. One of the books that I love in particular, because I love the author and I'm trained as a certified brain health coach through Amen University, is Daniel Amen's Change Your Brain, Change Your Life. He talks about some of these mindful techniques, but he also gives so much more information about our beautiful brain and how it works and what are like additional things that we can do to work with the brain we have rather than sort of fighting against it.
Yeah, there's a lot there to tap into and that people don't know, but you know, I think the quick answer is people need to slow down and just stop.
Absolutely. Kathy, that is really, I mean, if I had to funnel everything I've said down into one thing, it's get off the treadmill as I described it. We all have these roles and responsibilities, and we're pretty good at showing up and fulfilling those, but often at a tremendous cost. And the cost is not creating that pause space, that Kiev time to say, what do I need? Mm-hmm. How do I need to replenish? How much deep breathing do I need to do so I can show up in a much more intentional way and give myself that self-care as well?
So Karina from Kitsap Regional Library just posted that they have available breathing space, 12 lessons for the modern woman.
Wow, love that. Love that.
And yeah, so folks can go to chat and check that out. And it was intriguing when you talked about the physical impact that not paying attention to your well-being creates. And
yes,
I wonder if a lot of people are going to the doctor when maybe they should just stop and take a moment.
So we're seeing huge, I mean, I'm a counselor and I have a private practice in Silverdale along with the business coaching I do. And I'm seeing both in leaders and you know, moms, and I mean, it's across the board. We're not talking one generation. We're not talking one gender. It's across the board. The increase in depression, in anxiety, in downright despair for a lot of people, feeling helpless and hopeless. And I'm just here to say that there are ways to feel better, but you have to be willing to invest in yourself. And that means slowing down, creating that 10 minutes even to start. 20 minutes is even better. Pause space in your day so that you can deep breathe, so that you can set an intention and funnel it into an action plan. Let the people around you know what you're doing so you can take better care of you. That's going to have a profound effect on your immune system, on your body, your energy, your mood. It affects all of that and more.
Wow. I appreciate you taking the time. And if we have a minute, if you want to talk a bit about Live Well.
Thank you. Thank you. Thank you. So one of the things at Live Well Kitsap, we started out as a 1 day a year annual event. Through the pandemic, we've evolved. We're now an online well-being community website. So livewellkitsap.com. But even more exciting than that is we're having a 6-week community challenge that will kick off February 1st. It's completely free to the community. All you have to do, go on the site, hit subscribe, become a member, community member, all that's free. And then we're going to talk about 6 weeks, 6 different topics during those 6 weeks. And we'll provide you with everything you need. We're going to provide tips and tools to be successful. There'll be these small to-dos in each one of your day that all pertain to the topic for that week. We encourage people, grab a buddy, a spouse, a neighbor, your church group, your whole workplace, and sign up for the challenge together. Because I absolutely believe with all of my heart, it does take a community and we need each other now more than ever.
Yeah, so it's another way to connect.
Another way to connect.
It's a way to gain control of your well-being.
Yes.
So it's an extension basically of what you shared with us today. So exactly. Thank you again.
My pleasure.
Joe, I will turn it over to you.
Thanks so much, Kathy. I think I'm off mute. Famous quote of 2020. Are you on mute? Are you on mute? Are you on mute? Leslie, I want to say thank you. And this is a topic that is too often ignored. Our mental and emotional health. There's lots of evidence, folks, about this pandemic and how it's affected substance abuse up 250%, how more of us are less empathetic than we have been before. And, you know, this medical crisis brings with it, this isn't my idea, this is actually the idea of the CEO of Kitsap Credit Union and others. This medical crisis brings with it a physical crisis, an economic crisis, and a mental and emotional crisis. So Leslie, thank you for talking about breathing today. Thank you for talking about how we can take care of ourselves, pausing and setting intention. This really matters. Thank you so much.
My pleasure.
We can go to, and also livewellkitsap.com, folks, because she's one of our own and she's helping take care of people in a cohort. Livewellkitsap.com. I want to go to our partner, if I can, if we can just show the great Bruce Kendall out of Tacoma Pierce. Bruce, what's going on in Tacoma and Pierce County?
Well, thank you, Joe, and Kathy. It's great to see you. Leslie, what tremendous opportunity to learn from you there. Thank you very much. We have been a partner with the Kitsap Economic Development Alliance for many years. We're the Economic Development Board for Tacoma-Pierce County because there really are no borders when it comes to the economy. And so appreciated what I've learned here today. As many of you know, Joe participates as a co-host of our weekly 11 a.m. on Wednesday COVID business information series that we've been running since last March, along with the Tacoma-Pierce County Chamber. Very similar to this, bring experts in to provide information that's helpful to businesses as they deal with everything related to the pandemic and beyond. So appreciate the chance to say hello to everybody in Kitsap County. We're joined at the hip, and the economic development ecosystem is strong in this region and in this state. And we anticipate we'll be helping each other lead the recovery in this state and nationally. So, Joe, I could go on at length, but just wanted to thank you for the opportunity to say hello.
Absolutely, Bruce, and thanks for having me on your weekly webinars and joining you as a co-host. Appreciate our partnership. Folks, those happen every Wednesday at 11 a.m. You can sign up at the Tacoma Economic Development Board or the Tacoma Chamber. Let's see, we've got in our next Kitsap Digital Hour, the first Thursday of February, we're going to be talking about economic equity, equity of opportunity, dismantling barriers and expanding opportunities. More details to come. And then obviously, I think I already said February 18th is our half-day economic forecast. Please mark your calendars. We'll be setting up registrations for that shortly. If you have ideas on what you'd like to see on these webinars, if you have ideas on working on items for our economy like tech, defense, and entrepreneurship, just reach out to myself or our colleagues at kitsapeda.org. Reminders, the SBA is the primary source of economic relief for small businesses. So there's plenty of webinars coming out. Look at the Small Business Development Center's website for that. Other reminders, shop local, shop local, shop local. We are not out of this, not by 1,000 million miles. We have a long way to go and months ahead. Take care. See you next month. Thanks for your time. Bye-bye, everybody.